Yeah.
Call meeting the August 8th public hearing on the 2023 budget for 2024 budget. Any public comment? Hi, Vince.
Hi.
How's it going?
Good.
This is it.
Is it? It's so exciting.
Tanya doesn't.
It's exciting.
Just
Board
exciting
meeting of
stuff.
the year.
Quorum. We have a quorum here. Yeah.
This is the most exciting part of our lives.
Ryan's on his way.
6. We have 6.
Ryan's on his way.
Ryan's on his way.
How much for a quorum?
You don't need a quorum for
You don't.
this.
You just need, you just need a few butts
Not
in
for
the
a budget
chairs.
meeting, I don't think.
Okay.
I don't think you need one.
So I'm a newbie. Because I vaguely remember doing this last. Do you present during this or is it just for people to ask questions?
It's just the public's opportunity to come in and weigh in on our budget and direction that they want us to go.
Anybody weighing in, Claire? No, nobody?
Waitlist. We are
We on
waitlist.
there yet? This is how I remember the last one was like. nothing. Do anything.
I don't know if I've ever seen a public person come.
Well,
person that comes.
it's just the law.
It's a
our
DHS requirement,
DHS requirement.
So is there,
a state DHS.
I was gonna say as a public member, I want to do something about our regular Christmas.
Well, you have a chance to do that down here at number 12.
I'll do it officially. Yeah.
We think we talked about this last year. We have to do it a half an hour before our meeting, or can we do it next year at 15 minutes?
I think it's always been a half an hour, so I can follow up with the state to see if there's a time limit.
We should have bought donuts.
We should have, we were thinking about it and then we crapped out. Well, she's gluten-free, so I feel a little bad about bringing donuts with
Oh,
the
no, I can get my
gluten-free.
own donuts.
Oh, yeah.
Marketplace.
Gluter? You're a gluter, an anti-gluter?
Can I get Uncle Donuts in back and a half?
Sure.
I may have to have a deputy follow me.
Yes.
I have an escort here.
I brought Uncle Donuts for my family was visiting from Atlanta in June.
And it was just
My great nephew turned 15, who's taller than I am, of course.
every single day.
And his request for his
Go
birthday
over
party was
and
donuts.
there.
And
Oh,
so
really?
I
Yeah.
said, well, how many should I bring? You know, it's just mom. And she said, oh, like 2 dozen. And I think she was thinking like donuts. And I bring these old donut things that are as big as your head.
Yeah.
And they're like, wow. So there was like, everybody was
Yeah.
getting donuts.
Oh.
They were so
It's
huge.
a full meal deal.
Yeah, it's not like the Swedish bakery, right? You know, where they're like a normal human sized
Yeah.
donut. You
Yeah,
know?
right.
Actually
I love
prefer
those
them.
things.
I love them.
Go so with it.
Yeah.
Indian.
But the nice thing is, you know.
Tess.
people in the next door family, like, here,
Oh, I
here,
know.
I just
Today's your
went in, I
friend.
just.
Yeah.
went to the-
How's
the
how's,
store,
uh,
so She doing me all the time. Give me some stuff she can bake with.
When I was diagnosed, like,
She drinking enough water.
She's
got her drink water. Even though it's a lot of work.
the one thing I
to go to the
really
bathroom,
missed was
to wash and water, because they don't want to. She needs to drink the whole water.
You can figure it out.
And then
I tell you, it's
trips to
actually.
the bathroom.
I did it. I started business on it.
Yeah.
And I made them at events, and then I started a whole line of.
Did you just coat them with a raised flour and fry 'em, deep fry them?
It was more than, it was corn, rice.
I actually was in.
Oh, you
ER
could have
Side cheese,
put the batter on.
and First time ever, diverticulitis.
Important thing.
No, cheese curds are important.
They are really important.
Okay, so number 12.
Another thing.
Hey, Ryan, we're just in a holding pattern until 8:30. We're just.
Yeah.
So I just rewatched the video. I mean, 9, so you could probably.
Joe?
No, we're not.
I could get
I
a
was,
bid, we
but
were
I was.
interested in.
But
the
I'm getting,
number of
going into the
trees.
jail for the educational program.
Oh, yeah.
Because I used to go to their Friday because I was working with a lot of those inmates
Yep.
and I used to go to their Friday stuff, you know, and I'm kind of semi-retired out of there.
Keep trying to quit.
Yeah, yeah.
She's a first grade.
Yeah, it's, I think it's going well. I think we have a CJCC meeting,
Anyway.
a full board meeting coming up. Let's see. Thursday. It's either next Thursday or the Thursday after.
Went out there.
No, I'm curious because I just went through my situation and was really
They're doing, I think it's going really well.
such a great
They've
idea.
got some great staff people
Yeah.
that are working.
And I've
I
seen.
think the district attorney's office,
Is it really something that?
judges, they've got a good, I hate to say it this way, but they've got a good thing.
And then I go back to,
It's like if you just see the same people coming in again and again and again and again, and even, ever more
when,
messed up,
Yeah.
messing everyone around them up,
Oh, yeah,
it's like,
absolutely.
and
yeah, I watched that and I watched like the sheriff's been right up in front of everybody and so we don't.
You know, and chatting with both the male and the female,
And
Well,
we're
now they're
under.
It's very defensive.
just admits that.
Now, we're seeing it.
They were in jail. I mean, going just one-on-one with them, I mean, they know that there's an issue.
Anybody that's tough enough.
You know, and it's just interesting to talk to them because you get,
It's a genetic.
it's one of those things where to them, it's hard to
Just like
break.
Well,
with-
except for that
Like
lady.
them as an addict, yeah, they're an
Or
addict.
do you ever?
But
Yeah.
on the other hand, they can't break that cycle because of their kids.
She had a tattoo.
So when you sit
So
and you
our-
talk with them, you know, and it's not necessarily an interview. You can glean an awful lot of stuff from them, and I ask those questions about.
So without that, without that,
And it's,
And they saw it.
there's a million answers.
Yeah.
of course.
And it's not excuses. It's, yeah, and it-
Ask
I
him.
wish Pat would-
I'm gonna ask him, heads up.
So
You're asking them.
I just think that
No,
the people that are
without the
working with them,
opioid funding,
try and support them once they get out,
some of the shared
housing
revenue
and jobs and.
and put that towards
Same.
Actually, it.
Is extremely
programs.
important.
It really is, because it's like, it's a whole
Could've, yeah.
system.
No.
But I mean,
No.
and he never intended to.
Drama and
He's got-
equity
he's got a
and
mother.
social stuff and insecurity and.
You know.
I well know.
So it's peer pressure.
And I know that there's the naysayers out there that don't like
Yeah.
She's not gonna.
that. I mean, that's the norm.
So who's
Why are you?
the-
spending
You just
money
pull
on-
yourself up while
It's
you're.
going
out the door.
Yeah.
No, I understand it. I'm from that generation.
So I'm gonna sleep.
Not helpful to get a good
Just-
certificate.
That's right, yeah,
Somebody there.
And
See, I'm doing at the church.
maybe one of these days it'll actually work, and we'll just keep persisting in this thing.
I know that.
I'm gonna smack you when I drive, you're gonna get a message.
Find out Saturday
Never
morning.
understand that.
Go and check
You
it.
guys have that in the yellow.
People like anybody
It's
else.
gonna be
Medical
good.
examiner.
Fairly, and,
Yeah.
Used to be a
everybody makes
coroner.
mistakes, sometimes not as big as the ones that
John was
they
the
make.
coroner.
And frankly,
When I were elected.
3-hour
Yeah.
permit.
I mean, when I have to make mistakes, I
Medical
have.
examiners are appointed. Yes, they're hired. So it's gonna be a
That
little.
makes it a good social deal.
Yeah, I mean, I thought,
I'm
You know,
I'm a white lady. I get a lot of,
Dave Horsch.
a lot of
I
passes.
thought that was something.
Now I'm a white old lady.
But I always-
There's even more excuse.
I told the guy one
I
time, I
mean,
said,
kitchen.
Okay.
you're
A lot
almost
of
perfect.
exact-
Get up to get back.
You still have a crack in you. This guy looked at me going,
Swear.
yeah, but so do you.
When-
I said, but I admit it.
I got a codified surprise.
Where'd you come up with that? I got,
Yeah, I think that was-
Grandkids start. Louisiana now, but.
Yeah.
School, tenth already. They got married.
Yeah, I do. I don't know if I answered it, but I think back too, I thought it was great. Being a teacher at the summer school for somebody like that.
That's where they're going.
Yeah, and his parents. Did a
They
teacher
would
meet
have
and greet
brought me
on
up to a
Sunday,
yard arbitrary.
which I thought was really interesting, but. And it's like September 20th. It's like,
Is there anything you missed?
It's the best time. Granddaughter is to be,
I miss
but my
the kids.
grandson not so much.
You know, and I have
We
enough
watched
contact
the
with
show.
them now. I mean, the
I'm not
day-to-day
leaving
stuff,
till the
you know, I
20th.
really do.
It's called.
It sounds silly.
My dad was a teacher. I
By the
guess.
way, I might be
Yeah.
picking for that $1,000.
Yeah, I bought a bunch of them last year.
Oh, yeah.
It was a
Yeah.
support process.
You gotta go to Renee.
Grandma.
Get sent to the office or something, tell them what they did, okay, well, let's chat about it.
Yeah, last year at this time, I bought a book.
I can't kill you now.
Big grandma.
Last year,
Send a message.
the Friday night.
But, yeah, I had great support.
Pulled out his ticket and,
You know, and I had a laugh, I had a couple of people.
he won the $1,000.
I was out of the office for a meeting. and
I
I was running a meeting.
think he left the next half of it.
Are you ready?
The standing joke
Dean
was.
won it 3 years ago.
That became our favorite.
But you know, I had my, I had two administrative assistants in the office. Those
Yeah,
gals,
Roosevelt, I didn't.
they're,
Baseball game Sunday.
the two that I started with are both gone,
I got so much.
Patty Berger.
but
Give her a
their
couple
standard
books. She handed,
I've been
came
registering
in,
this
I
car.
had a kid that came in the
it
office.
was an 18-year-old girl. She just enrolled in her
Should say, you're here
So I bought it in
because
Colorado.
well, I just got kicked out of class and I was told to come
It's
down.
always
here.
Yeah, oh, I know.
And Judy would look right at him, she said,
I
"You
got plates for it.
Did you see it?
That's your day.
Been registering it for.
You really don't want to go in there today."
It's my I drove by the.
The poor kid would be standing there,
Title for it.
so.
There's no
what-
title- or there's
See
no
that
title
chair?
for it.
It's in the community and it blends in.
Sit there and
You
then
go down the road, you just see.
you'll get over whatever you get.
You know.
Be a register a
And sooner
car.
or later,
It's so
he
funny
will get to
because.
you. Today's not your day. So but they had
Right below.
half of the kids that came in, I never saw.
Each line will come.
Yeah.
Mom worked at Stillwater High School. She had her degree, but she ended up being aide in the library. And basically, she was a teacher that they should.
The insurance policies and
Counselor, she was that
Oh, yeah.
It's like.
Church splitting hairs.
Yeah.
Say her job was telling kids to. No, actually, I think.
They owed like $2,500 just for
Saving people's lives. You know,
It disappeared out of my.
just a good
So I
listener.
call them and
Fire.
this is
Anyway,
exactly.
she loved that.
It should be.
Loved it. My dad loves teaching.
Look at the money.
He's got the title in the mail. We're clear.
Sure.
What did you think about it?
He would never.
They're all in, they're all in,
And,
they're all in the same boat.
I love it.
Thank you. Which is good, because he died young.
And then, yeah, if I can just take this is what I awesome. That one's worse, well, that one's crazy. That one's worse.
You just can't hardly turn on the.
I didn't talk to him.
They need to do is move.
Early, and he's like,
Every word.
Yeah.
and then, so he just like went out and
Just get.
fixed things at the chapel.
Wild.
Okay, she was trying to.
Down trees and smoked grass and just all of it.
Neither one of them.
So,
are-
I'm glad that he did, that he didn't
You know, the
just
one
struggle through.
How funny.
Would have been.
He had. He died at 67, and I think he left at 55.
That little rascal.
And then the seniors like on.
You sit back
Yeah.
and you think about.
Loading,
You asked me
Weren't
about
ready for
this.
that.
So I was,
But he could have been a.
I was in
It's real
high school.
interesting because I always had a,
Just
and I say this lovingly,
all this
I
extra.
always had an itch for kids that were always in trouble. I
Just
never did
have
really
this and be
want the
done with it.
valedictorian.
I think we're ready for a
Chase, Chase his brood.
You know, spite me.
They were gonna
succeed.
They're both that.
Kids that were on the fringe all the time. I like those kids. And I enjoy one-on-one
No
like that
worst
because you
enemy.
get some insight into the way some of those kids think. It's a whole different plan.
I kid you not. I kid you not.
Impulsiveness, you know, I understand that, you know, you can just.
Try to catch the train and.
As a parent, you see that in your own kids, you know, and
I
you
was
see
over
that
there.
impulsiveness where they.
Maybe
But I like those kids an awful lot. I remember being down in Menominee and Menominee High School.
You know,
They was sharing a, what they call called a North Central Review of school districts where you go in and you have to do everything from curriculum to whatever. And I chaired that. I had a committee of about 16 people from all over the state.
But I'm afraid.
So I wanted to do interviews with kids.
If I did it, I'd
So I
probably be
went down to
assassinated.
their study hall.
Sorry.
Cafeteria. and I swear
That's
to
what
God,
you're.
sit 500 people.
this is the time.
Huge, phenomenal high school big. So there were 4 people, there was one in each corner that were kind of supervising these kids in there. And I said to the one guy that was in there who I knew, I said, so how is this divided? And he looked at me, he goes, what do you mean how is it divided? I said, I know how this works. I said, you have good kids, bad kids, and fringe kids. So point people to me.
So that's.
I knew exactly what I don't like those. Well, he says, now we have the geeks over here and we have this and we have this. So I went right to the center and those were all good.
Oh, there was a follow-up.
They've got to show them.
I mean, all kinds of.
All the interesting.
I went right to the center. I sat down and I was sitting at a cafeteria table and this kid turns around and
Innocent
says,
people
what
watching
do you
that.
want?
Well, at some point.
And I said,
to get on her list.
Can I
Why
just
can't
ask
we
a couple
get
of questions?
On the list.
Well, then I kind of
Just to do
engaged
that,
them and I got
Do something.
20 of them sitting around.
Because
I got
He wants to be
insights
abreast.
from Menominee High School that I would never got from anybody that's an honor student.
getting out there and,
Oh,
you know,
absolutely.
getting rid of.
What's
this
good,
stuff.
what's bad, what do you like, what don't you like? What can be improved? What do you think should be improved?
Chair of the Osceola.
And who on staff do you think we should get rid of?
They're just
I-
going
I
down
said
the
that to
road.
him.
They said, ours.
Nobody, we like everybody.
And that's the way I want time to go back to.
There.
But it
They
was,
lived
but
on
it
a
was funny and I,
dead-end street.
you know,
Yeah.
he asked me, why are you
School was right
I
behind
had
them.
fun.
And this was turning out.
And that's-
One Sunday
that's
afternoon.
right.
Good fun, you know.
Because they'll never forget.
Daddy.
You know what I mean? It's like.
Right by
Never
baby
forget.
boy.
Yeah, I'll take it.
Whatever.
Their thing.
Ryan.
And then.
I had, you know, Ryan.
Right
Ryan,
in.
Ryan.
I bet he's insane.
I know he was, he was a good kid.
Oh, yeah, they.
These are all.
He and his sister and
Election.
he had fun.
This is why we.
That was.
So, you know, I look back. This is
Aunts and
funny.
uncles still call him Jackie.
Yeah.
Jack.
Yeah.
It's like, what?
And that's it. A lot of people.
I don't.
Hey, Don, how are you? I was almost texting
Yeah,
you.
sure.
This is not, I got to tell you one.
Let me see any guidance on it.
You got a second, 35-year-old, 50-year-old.
Not just when they're little kids.
Exactly.
You look at
This kid was so
Our oldest granddaughter.
I shouldn't even say this out loud.
Did spare the good.
I had 3 of them in a senior.
We're the criteria.
Literally, just physically.
Yeah, we're really.
One up there.
They call him Hank.
Right now, I shouldn't have done that.
That didn't go over.
Yeah.
No, she was like about it.
And and so I.
I don't even know.
What does- I wanted to stay after
I know they were, receive it in and then.
Okay. So we sat down.
And then. Because Vince can tell us all.
Yeah,
about
His
that.
cat
When
my
year
dad
epic fail,
was
the
a
meeting.
senior vice president. Something else always comes up. Somebody from the stock market.
Oh, my God. It's all good.
Your place is here, you down there.
Okay. This kid ends
They
up
don't-
taking over the community because of their stock.
This father there.
Well, true story. He called me one day, just after everybody just. He called me.
There you go.
Then you come up here and Woody never.
I said, what do you want, Chip? And he goes,
Yeah.
All my friends call me Wood, but never.
I said,
I don't think.
Ours
it's
were
that's nice.
always Levac. So they played.
He said, well, I'm only answering.
That's true.
They're always
I
Levac.
said, you're a little shy. I said, I'm a public servant. What do you think?
We loved it.
I was working with you.
Yes. And so.
Isn't it funny how that works? Yeah. Years.
So he had, there were 3 rounds.
It's a little easier.
you know.
The oldest one is.
Dr. Leva.
Hi, John.
Have you got a
And like that one.
football schedule?
So I always put.
Of which school?
Figured out, we just.
Are you repping? and-
Yeah, this is my last year.
How many years have you told your wife?
Hoping this.
56.
I'm sure she's. When the kids were.
All 56 of them.
Whatever we get.
You got a good schedule?
Yeah, we're all right.
How are today?
We're good.
Camera off, you sit way down here.
Oh, I get
How
it.
many people do we have in football?
In the state?
No, I mean, three on each game.
Oh, I'm working. My crew has got
Not
5.
get a deal.
Yeah, if you're gonna do any college games, you gotta have at least 5. Usually works at 6.
Oh, no.
And you got a referee, you got an umpire, side judge, field judge, and then you got a strong safety judge.
3 weeks. And
I got a guy that I work with that comes up.
my stereo.
Oh, yeah.
We can.
You usually
I know, neither. I just feel like.
Emperor and get out of.
Yeah, they make me wear the white hat. I'm supposed to know the rules.
No, but,
Well, I'm sure you do.
Yeah, they make me do that. I was, every time I talk to, if there's a question from a head coach, he'll come out on the field. I said, I'm not talking to you. And he goes, well, why not? Because you don't know the rules. Give me one of your assistants. The assistants always know the rules.
That puts them down right
That's why
away.
the
in their
assistants are
place.
there. The head coach.
But you're traveling.
I said, you're the guy that
Yes.
handles the offense and
Yes,
the
we
defense.
have a wedding in
on the
October,
numbers."
we're not
I said,
sure.
your assistants know the rules.
You got some
I
college
took it
games?
and said, I think.
No, I didn't take any this year. I didn't take any this year.
See how cool.
How well do you know Nick Bean?
I know Nick Bean.
Yeah.
How are you old enough?
When I was at St. Croix Central,
Today
he
was
was the
there.
curriculum
We
director.
have
So
a
I was pretty happy when I thought that.
Yeah, he's one of Unity.
I know.
Who
Yeah,
is?
he'll be a good
Yeah,
one.
Nick, well, it's gonna be interesting to
Who's
see how he
that
fits
girl?
in.
Nick Bean,
Yeah.
St. Croix Central is a
Yeah,
new
we
high
gotta have a
school
plan for
principal at Unity.
1980.
He was at River Falls before that.
Yeah,
Oh, yeah, yeah.
a good guy.
I had
And
suggested to her,
Logan Kimberly, who I graduated with.
even if Katie, like I said,
Yeah.
someone.
Yeah.
Said it felt like
Yeah.
you probably.
Did you play any college ball?
So anyway, it's
Good.
it's been fun. I just.
I took Gabby and.
We're at Michigan.
Right, and that's kind of nice.
Yep, I do.
Yeah.
That's why I went there.
I watched a lot of ball, basketball. I got a good
So,
Against Greg.
Well, hopefully it'll answer.
Big rep.
Another guy and I will sponsor that.
I want to go to see.
I was done. Yeah.
You drive, do you?
Every time it was.
Get board on that.
Yeah, we need to get that figured out.
Very favorite.
Yeah, I think so. I think
There was some good guys there.
Excellent.
Yeah.
Did you,
Oh,
did you see that where Osceola summer team state tournament in Winona?
I have my jacket on.
I thought all the. And Bradway's got a younger brother.
When do you leave Texas?
Young.
For 30 years, so it's like people keep
There's
finding
a-
out, which is great.
There's another kid that's a sophomore. You're gonna hear this name.
I'm doing a 90-minute training from my living room today.
Rebecca.
It was great.
About
It's
a
like a
six. The only, to me, the only chance Osceola's got really is if he can play the post.
Yeah.
And then like,
He can
friend
have a good post. We got Brown.
give all the, take a
Kid.
vacation and give all the money.
He started off, but he's gonna foul out.
Fine, I'll be ready to move this thing.
And Urbeck is gonna have to come in and play that.
So now we're moving.
High school, yeah, high school is still a game where you can.
They, take some of their farm product.
Yeah.
They don't do it so much in college.
No, Tommy, hey, you get in there and you block out. and
High school, you still.
And then I
High school, you
inquired in Minneapolis that we sing for people on.
Only don't bring that goddamn ball down before they go. Why do they do that?
It's all up here. You think you gotta. I got told all the time, keep it up here.
Keep it up there.
So anyhow.
All those little guys.
Stop it. Stop it.
But I say, you can't keep good people
I'm
out.
just interested. I love that work. I mean, it's that work to me.
It's not work, it's a passion.
It really is, and I feel so grateful that I, you know, and
Yeah,
over
like last
time,
night,
you know,
I
used
don't
to
even
lead
know
this
how big
big
this town
series.
is. So you're
And
from.
this for many, many years, and again, we get one of the the church is beautiful art gallery.
Oh.
Graduates like.
Yeah, I know, I had to find.
And just literally seeing
Are you
for 2
kidding?
hours. And
I know, I'm not
This is
kidding.
a senior day.
no, but I graduated that. You know, I always would take money, but I would say, you know, I'd have a list, they'd add to the list.
And all that
Talk about this class or that thing. So I did use it in that way.
I tell them we're gonna take it every year.
Do
get
you?
that out there.
It's much smaller.
That's a good thing.
That's
the most important.
I hold this Sunday too.
Sweet.
That
Kind of stress.
You give me some tickets.
This is totally empty.
Oh, all my cousins know.
Yeah, that's
The
nice.
sax instead of Saturday.
Yeah, a new car. Or 1,000.
Ryan's sister just wanted to go.
She just needed a phone number.
When we
I
got
know
it.
what they do.
And I said.
I know what they do is they get-
And I walked
they
right
get
down to
Johnny
the-
tickets,
And they had the.
everybody says, well, here, I'll donate to like the hardware. thing. For half an hour per day.
There's a trail that we.
You gotta be there for that.
And you don't have to be present.
Not yet.
Yeah, I love it. This weekend, Joanne.
Did you see all the stuff?
It was a Patrick Ryan show.
I had my moments
I
and
know
Zach.
when Chris,
It was good.
I'm not sure, but.
yeah.
It was a Friday.
He's
My
been
son got really great.
You must have some there people that-
There's a spot there.
So we're gonna.
I'm
go
good.
eat
How was
on
it?
Friday.
Yeah.
It's, yeah, he's good.
It has been just such a fun part.
Yeah,
Living
yeah.
where I live.
Oh, help yourself, doc.
You know, 40,000 a year.
My uncle and.
You're not working this morning.
Some money here.
One year, I'm way down. That used to be when they used to be $1.
Ryan has his son actually.
Just here, $5.
They got 50.
And go to Fort Zachary Taylor.
Yeah.
And all around that, sandwiches that are like.
We had no public.
Like,
Travis said he's never,
get right out, you're standing.
never had anybody.
This cost more than. In a basement.
We did it when it came to responsibility.
Yeah.
So that's
Garage last night sold
Dropping.
cars.
And looking at the garage.
Ryan was impressed.
Hello.
He's like, we
They were out with the
garage. I can't even park in my garage. I have some garage.
three girls got together and Linda got them.
I lucked
Oh,
out.
yeah, she's hitting a. Don't mean their own room. She should be in the, I was doing Medicare.
Yeah.
With rate, year round, and that's a big thing. If she gets a nice.
Connie will tell me that.
They don't need it. Once they're,
All right, folks.
we need to think, I have
So is he.
So there's, she knows what she's doing right now. If they're all in.
Okay, we're gonna call this hearing to a close.
I moved to close, yeah, you do. I
Okay.
moved to close our open
Public here.
public hearing.
All in favor?
Aye.
Opposed? Okay, we are closing the public hearing now. And we are starting meeting, so we're just rolling. All right, so let's open our meeting. I'll take a motion to approve the agenda for the August 8th,
Move to
2023.
approve the agenda as presented.
I'll second it.
Okay, all in favor?
Aye.
Opposed, same sign. Same on the minutes. I'll take a motion to approve minutes from our last meeting of July 11th.
So move.
Second.
Second, favor,
Aye.
opposed, same sign. Okay, we have public comment. Is there any public comment, Claire?
A quiet morning.
Yeah, could have played tiddlywinks. Okay, receipt of information from supervisors not seated as committee members. Anybody here? Nope. Okay, number 9 is recognition of Child Support Awareness Month.
Wonderful. So this came through from the state in an email to all the county child support and tribal child support agencies. And it is apparently Child Support Awareness Month. So I asked the clerk to put it on this calendar and for next week at county board. One thing that we wanted to share was out of $30.5 billion collected in the entire country for child support. 1 billion of that was collected in the state of Wisconsin over 2022. And that includes all the county child support agencies and the tribal child support agencies.
Wow.
So I think honestly, when we go to Wisconsin, to the National Child Support Enforcement Association meetings, and we've had the benefit of going to one that was held in Milwaukee a few years ago. Wisconsin is one of the best child support programs in the country. We're definitely in the top 5 as far as the amount of money we collect per dollar spent on the program. So I just wanted to bring that up and say that I think our particular county's child support agency is at the top of our state, and the state being the top of the country. I think we're in a good spot. I just wanted to share that information.
It's amazing. Okay,
Madam Chair, can make
yeah,
comment on
go
that?
ahead.
Yeah, and part of that, I would say, if you remember, anybody remember about 5 years ago, the state of Wisconsin really cut this, they almost gutted their child support money wise. And they got so much heat, that even, I think all the legislatures, that they really turned that around, and the legislature has put more money in and really supported the whole child support system.
There in the last, the budget that was passed at the state, there's specific additional child support funding.
Really increased it again this year,
Very grateful for that.
yes. That was probably the biggest increase in the budget was in our child support system.
Sounds like Wisconsin should present at this national conference.
We do often. You know, it's really interesting when we're dealing with interstate cases, and because we're a border county with Minnesota, we have a lot of Minnesota cases and we have to deal with Minnesota quite a bit. But we're also dealing with states across the country, and we're dealing with other countries that we have treaties with, Canada in particular. And it's so amazing. Like in the state of Florida, for example, they have a state child support agency. Nothing is run at the local level. And so everything is centralized, it's bogged down, it goes very slow. So we know when we're sending an order to Florida for enforcement, you know, we're probably not going to see anything relatively quickly. But when we send it to Minnesota, you know, they're on it because they're also have a very robust program. So it really does vary across the state.
Interesting.
The thing behind that, they really backed it up in our court system, like if somebody's back in child support, we can go and confiscate their cars or any personal property, and we have. And we have right here in Polk County, we've got confiscated some things.
Well, we put liens on vehicles.
Yep.
So if somebody has $500 in arrears and has missed a certain amount of time, they go on the lien docket. And so if they own a vehicle, it's titled in their name, or if they own any real estate in the state, then a lien will go on that real estate. So if they try to transfer ownership, they have to pay off the child support lien first. And we seize bank accounts and we shut off driver's licenses. You know, we've got the carrot and the stick. So we also work with people who are disabled and can't pay to reduce their amounts and stuff. So we're working to make sure that the program is fair, but keeping children's welfare in as the primary goal.
Interesting. Any other questions or comments? Thank you.
Thanks for your support.
That's really exciting. Okay, number 10, review and possible action on fee schedules and leases. There you are.
In the background. Thanks for the opportunity today to talk to you all a little bit about fees here at the county. We're in the budget season, and part of the budget season is for us to pass a fee schedule at the next county board meeting. So general government last month took up fees in general, and we recommended as administration that we consider raising fees where appropriate to keep up with inflation, or at least acknowledge that inflation has occurred. We did some retrospective work to see where we stood as a county with fees for 2021 to 2022. From 22 to 23, we had 461 fees that the county administers. So during that period, and this is the budget year we're in, we raised 16% of those fees, but we left 84% of them alone. So last year, inflation was running about 8.5%. Up through June, it was 5. Now it looks like it's trailing down to 3. We brought this to the attention of general government, and they endorsed the idea of us as administration asking departments and divisions to look at fee schedules one more time and see if there is any room to increase fees fairly, not overburdening the payers, but also looking to cover costs. So that was a request made by administration to departments and divisions. It was not a mandate. As I said, general government, the committee endorsed the idea overall. I know that within operations attached to HHS, some of those fees were raised. For instance, SCAM raised some fees largely due to increases in payments that would be coming from revenue sources for them. So basically, they could charge whatever they want, but they only get paid a certain amount by the federal government, ... So they raised some fees in accordance to what the movement was from the federal government on those. I don't think that there were many fee increases overall for CSD. In fact, what I recall about the fee schedules and the details is they actually took some fees off the books because they were no longer basically their services that weren't being offered anymore, had been picked up by other organizations, either internally or outside. So the big picture is we've asked departments and divisions to look at fee schedules. Some have increased those. We asked for no increases of more than 5%, unless just due to rounding, the fee ended up being over 5%. So modest fee raises from some departments and divisions. This is again, the overall county view, 30,000 feet. We are signaling that the county has to consider what happens when there's inflationary pressures in terms of fees. That's what we're trying to signal, both to committees, also to our departments and divisions, and really to the general public. So I'd be happy to entertain any questions about the fee schedule. It will be in front of general government next Monday. And then assuming that it gets approved, there'll be obviously discussion at that point. It would move on to the board for approval as part of the budget process. Denise.
I understand the fees, but what are the leases?
So I can comment on leases at a high level. They aren't approved during this cycle with general government. They are approved as part of the overall budget. We have, the door just opened on me. We are looking at leases. We have not necessarily had a rational lease program here where, you know, on a per square footage basis, organization A was paying the same as organization B. And I noticed that you looked over to your east. There are some good reasons that some organizations have very low lease rates. If you were thinking about Northwoods, they pay almost nothing for that space. The reason they do so is they're paying off leasehold improvements. So if you were to look at their square footage versus CISA, it's different, but there's a good reason for that. I've had conversations with Brandon Robinson, who's the new CISA 11 administrator, and they are open to us increasing their lease rates. They recognize that they're paying well below market. We won't ever ask them to pay market. We will always be subsidizing them because we think it's an important thing to do. But we're trying to get their leases over there more or less like what we're doing with Endeavors, which is another organization that we support, right? So you might ask, what we were asking big picture is why are the leases in Endeavors in the per square footage so much different than they are over here? Well, it turns out there's some good reasons with Northwoods, and it turns out that our partner in Season 11 is willing to look with us at those lease rates. So I don't exactly know why leases was on your agenda today, but there's my answer, and I'm happy to go deeper if you'd like. We do have within CSD, within their sort of your orbit, there's mental health task force, there's kinship. We have examined those leases. They rent very small offices and we don't charge much for them. And we're really not looking to move those much at all. But we do want to know what degree we subsidize those to. So that's part of this is we can say, well, we've got making a number up, we're charging mental health task force $3 a square foot. The market rate is $9. So we're giving them a $6 per square foot subsidy. We think their work is worth that. So that's why we're doing it. We think it's defensible. So really for all the organizations that are tenants, we're asking those questions of ourselves. We're trying to kind of get this lease world on a more rational framework.
Thank you.
Yeah, Ryan.
How does the housing initiatives, and particularly the ones where we're talking about easing up on the barriers for, I believe, fees and things like that, how does that fit into this?
Yeah, I'm not sure I'm qualified to answer that. It'd probably be better to have Bob in here. We do recognize that there's sort of competing pressures here. And I know that Bob has always been really good about keeping his fees in line with the actual cost of service delivery. I would say better than any other part of the organization. But I'm acutely aware that there are, conflicting pressures here. I'm sure he'd be happy to address that question directly. I feel like I'm unqualified to do so.
Any other questions on this? I got
a comment on, most of you probably wasn't here at the time, but Bob, how many years you been with the county?
Well, sir, I've been in the building for 5, but I've just been an employee for 1 because prior to that, I worked for UW Extension.
Where we made the big change, it was quite a source of income, was like on broadband, when they go under a driveway, we used to have our county inspect each one of these at a fee. And then as a board to increase the interest in broadband, we eliminated that and we no longer charge anything. It's a service from the highway department to inspect that with no charge. It's made quite a difference. And one thing you talk about broadband, as long as I mentioned that. One thing I learned that the legislative President Biden is going to be coming to Wisconsin on a visit. And he's going to bring along $1 billion to broadband. Each state gets so much. And with his political visit, to gain political notoriety, like Minnesota's getting 660 million and Wisconsin's getting $1 billion for broadband increase.
Sounds pretty good if that's a board priority, which I think it is.
It is.
last I checked.
Of all our legislative, I'd say 5 swing state broadband, even though each department is different, broadband is a big source in every one.
Chair Middleton, I think we're looking for a committee endorsement for the fees for organizations associated with HHS.
Okay, I did have one question on fees. If the recession reverses, do we ever adjust? If inflation reverses?
Right. So when we speak with our auditors, there's sort of 2 ways we could think about fees in terms of whether they go up or down. One is we can assume that the fees as currently published in the current year are accurate. And this may feel like kind of a punt solution. So whatever fee we've been charging has been accurate. The other thing we can do is look at the actual cost of delivery. And that's something that I mentioned Bob's been really, really good at. So that'd be time and materials, actually studying how much time you spend driving out to the site how much gas you burn, how much time you, adding it all up. So that's one way we could do it. The other is we can assume that the fees are accurate as published and then use some credible measure like the consumer price index to raise them or lower them. In some cases, we have lowered fees. So I think the generic answer is yes. If something turned around and our costs got lower, we would absolutely lower fees.
Okay.
So the hookup fee from a residence to broadband, is it different all over or how, like Polk County now, we're having big increases, but there's not enough people. You know, it's so much a month and people are pretty well taxed and we're not getting enough people on hookup that a business does or something like that, but the individual homeowner, I wonder if some of this $1 billion is gonna go to a supplement to make it more accessible or that's a question, Bob.
We might have to put this on, I don't know, are we okay on this topic since it's not on our agenda? Can we keep?
I mean, if you wanted to talk about broadband, putting it on a future agenda would be a good idea.
But if you have something short.
I would just say regarding the fees and the cost of hookups, that's up to the individual internet service providers. What we have done with our resolution is say, running it from the highway to the house. If they're going to take the county money and that grant we have, then the first 200 feet, I believe, should be paid for by the internet service provider. In the future, we will look at incentives that might include what you might call hardware or laying it in the ground as an incentive, but that's something that the board will have to decide as we move forward.
All in the topic under fees.
Yeah, yeah, okay.
Don, did you get an answer? Looking for the board.
No, you need a motion.
I was
It's like, you didn't give an answer.
I was gonna say one thing, you talked about prices earlier, like I love talking about this stuff. And I wanna make
Yeah,
sure,
you're a
like,
numbers person.
well, it's good that we all kind of talk about that. When you think about prices going down, prices generally don't tend to go down. Once they
I
reach
know,
a certain point,
I
they
know.
tend to stay there. And then, you know, if inflation even goes down to 3%, we're still increasing prices every year. So we're not really gonna expect, I would imagine that we're not really gonna expect to decrease fees. I'm not saying that we never have or never will, but it's probably not super likely.
Yeah,
But then my second thing was gonna be to say that I would move to endorse the fee schedule.
okay.
I'll
Second. Okay, all in favor?
Aye.
Opposed, same sign? Thank you, Ryan. Thanks, Don.
Fees
Okay.
and leases, so I know.
Number 11 is update on community health improvement plan. Ellen.
So back in May, Public Health kind of finalized our CHIP, our Community Health Improvement Plan. So this would be good through December 2024. And we have 3 objectives that we're still working on, but I'll give you like just a mini update. Our first objective is substance use and misuse. Since May, we've had an impact speaker go to 2 community events and 2 school districts. We are getting out more Narcan education and training opportunities. We've had tobacco compliance checks completed and our alcohol compliance checks should be completed soon. And the really exciting thing is last week we had our first community meeting to talk about substance use and misuse in youth. And we had about 30 different key community partners there. So that's just like starting that discussion and collaboration. Our second priority is mental health. CSD has been meeting with all the school districts to talk about how CSD can support the work that school districts do, and mental health is always something that we're touching about. Lisa's mentioning like mental health first aid training and seeing if we can connect the schools with those resources. So that's continuing. And our last objective is nutrition and physical activity. We have expanded our Power of Produce this year. So this is a farmers market program where we now have 4 locations where kids ages 4 to 17 can go and get free $4 tokens to be spent at the farmers market. So far, we've had over 800 participants at those 4 different sites, and we're partnering with Emory Hospital and Clinic, OMC, St. Croix Health, and St. Croix Valley Food Alliance. We have a good support collaboration there too. We're also promoting expanding our WIC Farmers Market participation. So far, we've increased the amount of WIC Farmers Market checks that have gone out, and they're slowly being reimbursed. That means that WIC participants are coming to redeem those at farmers markets. I feel like farmers markets are just starting to get rolling too with more produce too. So we're expecting to see an uptick there. Brief update, more to come. Any questions? John.
I think I can ask this question. You mentioned Narcan.
Yes.
I'm on the Public Protection Committee, and all our officers and everybody in that department carries Narcan. Tanya, I don't know anything about our public health.
So yes, our field-based staff have all been trained on using it. We did give them Narcan kits. We are part of Narcan Direct program from the state. Basically, we get it for free as long as we agree to be trainers, train people up. There is now limited supply of Narcan, so we are figuring out the best way to arm our staff as they're walking out the door with the Narcan. So it's not an automatic issue that everybody gets a Narcan kit or two when they get trained. We are placing it in our AED machines here at the government center. Also, we'll have a candy dish where our keys for the fleet vehicles are, so they can grab a Narcan kit on the way out the door, return it. You can't leave it in a car heating up or extreme temperatures, so we need them to be bringing it back and forth with them. So yes, we do train our field-based staff, primarily social workers, case manager type of positions, to have Narcan available to them.
Our schools all have Narcan available.
Yeah, as we're meeting with each school district, we're asking them about the training. Some districts have been trained by other law enforcement agencies. Otherwise, other school districts are interested in having us train and then give them Narcan too. We've updated our website where any community member can go on there and request a training either from public health, or there's other nonprofits in our county that also have this free Narcan Direct program. Or you can go on the website too and see how you can get it from local pharmacies, or what that would mean.
Thank you. And I have people ask me about that, and I've never known the answer, and
If I can
please
add,
get the answer.
Well, and do the local sheriff's departments have
Yeah,
have them?
they're all
set up? Okay.
if I can just add,
Yeah.
with the DHS 75 rewrite that happened a couple years back, so that is the statute that governs substance use providers. They wrote into that new statute that anyone who might serve an individual in our programs would need to know the signs and symptoms of overdose and be able to use Narcan. So we have actually had all of our clinic staff trained already, as economic support, the front desk staff too.
Awesome.
They're all trained.
So, thank you. Good. Anybody else? Okay. Okay, number 12, update on opioid and fentanyl.
So speaking of,
On that note,
Fits like a glove.
yeah, unfortunately.
fortunately,
So last month, I believe Supervisor Lallier Prey had requested some more information on the medical examiner's presentation to us for the autopsy requests from the sheriff's department to the medical examiner's office. So I did some checking with both sheriff's departments and the medical examiner. They are not doing tally marks or tracking when they actually do request. Chief Deputy Burrows thought it was about maybe 5 cases last year that they had actually requested an autopsy be performed on an overdose death for some criminal, possible criminal investigation of a drug dealer. So moving forward, I think they're gonna start keeping track of that because the committees are wanting to know. When I checked with John Dinny's, the medical examiner, we did 12 autopsies total in 2022, no tracking of requests from the sheriff's department or not. This year so far, we've ordered 14 autopsies. 7 of those he believed were directly related to illicit drug use or toxicity. However, no formal requests from the sheriff's department. So it's just when they're in the field and they're doing the investigation, obviously the medical examiner will be there, and it's through the talk that they are
having informally that says that it would be really nice to have some autopsy results on the toxicology and the cause of death for the person who is under the investigation, the death investigation. So that's what I have to give you for today as far as autopsies. It's something that if this committee would like, we'll keep better track of it moving forward, so we have better data on that relationship between the sheriff's department and medical examiner's office. Yeah. Okay, thank you.
Autopsies are direct hit on the budget. That's one thing the sheriff is hated to see every year is an autopsy. So it's just a direct hit right off the budget.
I could make a comment though. Your proposal is not to do more autopsies, but just to keep track of when it was related to drugs. And because the decision was already made to do an autopsy, but we're not formally keeping track of, right? Of a
Requests.
formal request.
I think the worry was that we would, as the opioid and fentanyl cases increase in the county, we would see more and more autopsy requests. And that would be a budget impact on the medical examiner's office. So I think it's something that we want to keep track of. In the event that we are seeing more and more from them,
Yep.
we'll have to figure out how to allocate money if needed, if that is the case.
So didn't the ME indicate that they can do toxicology reports?
They can, yes, but I believe in his presentation, in a case like that, they would want a full-blown autopsy to determine the cause of death, not just the toxicity in the body, but they would need that cause of death to be able to take it to court. Right.
If they're gonna prosecute a drug dealer.
Yeah, because he sort of talked about how they would use the information of the autopsy to tie it to that particular dealer to be able to have a stronger case on that.
Yes, the toxicology won't be a determinant of death. It'll just show you what's in the body.
Just about every accident court case, that's the first question that the lawyers have. Is, well, what autopsy show? Well, we don't want to get involved in that. We can help it.
Right, so example, one of the cases this year so far was a person found outside a flowage area. It was ruled hypothermia, but they did do toxicology and found no drugs in the body. So you can't make that assumption.
Any other questions? Right. Thank you for pulling that stuff together, Tanya. Okay, update regarding housing, number 13.
I think that might be the
It's
same
just
thing
our-
as number 19.
Kind of our standing thing, isn't it? Oh,
Yes,
okay.
that's their standing thing, and I would just simply say at this point, we can go down to number 19 now, or we can wait till then, but basically the update is we have a resolution drafted that we'll be presenting here, or that you can look at here, and then general government will look at, and then it will be it's on our board agenda for this month.
Okay, we can talk about on 19. Okay. Andy, do you want to get out of here? Thank you for sitting there so patiently.
Absolutely. Good morning.
Good morning.
So I don't have much for updates. We're just busy wrapping up all the appointments that we scheduled from the fair. So been absolutely swamped with that and the PACT Act, which is great. So a lot of veterans coming in, getting the benefits that they're entitled to. So we're happy to see that. One big update is now that Christian Community Home in Osceola, they hold a contract with VA for contracted nursing care. So in the past, it's only been Divine for Polk County. So now veterans have a second option or an additional place that they could get that contracted care at. So absolutely amazing with that. It's a great program for veterans who are eligible for contracted nursing care. Essentially, the VA covers the cost 100%. And then they're also entitled to keep that benefit or a benefit that they're receiving. So instead of that income counting as income or assets, they get to retain that benefit and then their care is taken care of at no cost to them. So, yes.
So Andy, is that for disability rated veterans or all veterans?
So the veteran has to be either have a combined rating of 70% or greater, or the need for contracted nursing care has to be for a service connected disability. So let's say if you had a veteran service connected at 60% for their heart, but they needed nursing care because of that condition, then yes, they would be eligible.
Thank you. Any other questions?
Andy, in our Wisconsin counties now, apparently there was a big increase in the toward veterans program from the legislature.
Yeah, that's another thing too. So we, yeah,
More benefits coming to Polk County.
through Wisconsin Department of Veteran Affairs, we were awarded a $15,000 grant, basically through ARPA. So yeah, we're working on coming up with a plan to use that. I'm waiting on an estimate that I've requested to have basically for like a handicap accessible door opener put on our main
A
suite.
lot of things.
You know,
Our Wisconsin county was very happy with the increase toward veterans.
yeah, and there's a lot of flexibility with that too, from what
I
I,
imagine a lot of that came from the request from you guys.
I'm not sure exactly. Well, the one I'm thinking of, the grant, I think that trickled down from the federal government. And it was distributed to the states and then out to the counties, but
Thank you.
Great. Thank you. Okay, thank you.
right.
Sandy. Tanya, he's on the go. Merger update.
Okay, we're bringing this to you as we have been working on a 4-county WIC merger with Sawyer, Burnett, and Washburn counties. It's always been talked about here. Polk County's always had a pretty strong WIC program, but with the staffing crisis, we're finding that dietitians are really hard to find, along with staffing in general. So I believe that the state had approached us a while back with some of these smaller counties around us having some retirements coming up, and about doing a consortium model for WIC services as a way to be more efficient with our staffing and provide some better enhanced services to the 4 counties that will be in the merger. So first of all, everybody's heard of WIC, right? WIC has been around since 1972. Federally, it became a pilot program in Wisconsin in 1974 for a year, and it's been in existence ever since. So the WIC is Women, Infants, and Children program. It's a nutrition program, a nutrition and health program, typically administered through the health departments throughout the state. So what is all in the WIC program? We have breastfeeding support. That's one of the requirements. It provides food benefits through those vouchers. Nutrition education, that's the dietitian meeting with the women and families. And then also making referrals to community resources for healthcare and other needed services. We also provide the farmers market supplemental income through the WIC checks, part of those food benefits. We do, right now through the pandemic, we went all virtual across the state. There were no face-to-face visits, I don't believe, were there? Totally virtual through the pandemic. It's every 3 months. I believe they're looking at a hybrid. So we are starting to bring some face-to-face back in-house in August, right?
Thursday.
Yeah.
Coming up Thursday in-house, face-to-face. So that's exciting. So then at those in-house face-to-face, we do height, weight, and hemoglobin checks. So who is eligible for WIC? So pregnant women, currently pregnant or have had a baby in the last 6 months, if they are breastfeeding a baby under 1 year of age, and if you care for a baby or a child less than 5 years. So it's up to 5 years for potential eligibility. They live in Wisconsin, there's income limits, and they need help with nutrition and or health counseling. So what are the benefits of this merger, right? Who wants to take on more work? As recommended by the state, the big thing is less duplication of administrative duties, which saves us a lot of time and money. The state figures it's about 25 hours per month for the WIC director. If you have 4, that's 100 hours a month, where we can streamline that into 25 hours by having one person do the same work for the 4 counties. So the 25 hours, this one is speaking to Burnett County. 17% of their time is spent on administrative duties. But again, we're pulling that all into the 25 hours for one person to do it. Polk County will be the fiscal lead. Typically, the largest county is the fiscal lead. We will realize some increased revenue because it costs us money to have our financial team doing all the billing and collecting the money for those services. So we get some administrative fees on top of that. And it saves that dietitian time, so they're not having to do all of this administrative work. They can be spending more time with their families. We also, on the customer care side, we're providing backup coverage. So a lot of these counties are one-man shows. So the WIC director is also doing the administration, the support, and they have no backup. So if they take a vacation, WIC goes on hold. This will provide a service model that allows for us to cover each other and provide those services 5 days a week, either virtually or in person. More clinic hours, so it doesn't matter what clinic they want to go to, they can go to any one of the 4. Well, actually, we'll have 6 clinics within the 4-county region, so they can choose where they want to go. Our technology will have a call center model, so we will be the phone answerers and we'll direct the people to where they need to be rather than having 4 different office setups. It's better knowledge and expertise, focusing primarily on one program versus several. And the staff retention is huge. I think we all feel that pain over the last few years with trying to find good quality. So these are just the bullet points on efficient use of staffing. So our registered dietitian time, I think dietitians might be right up there with as hard to find as a nurse nowadays. So really limited on our dietitian time. We pool our staff time to cover time off. We're balancing their workloads better, and we share that project director. We increase the availability of services and the program efficiencies. We're looking at Google Voice, call center model, virtual hybrid appointments, so we can see more people. And then the balanced workloads, expertise, and greater job satisfaction when we can share that workload. Next slide. This is just a show of what is currently for WIC participants in each of those counties and the FTE breakdown. I believe we are looking, was it a 0.6 that we're going down in the first year?
And I think, yeah, 25% reduction.
20, yep. So we're able to, next year going in through 2024, we have 4.6 total staff in the 4 counties. So it will be 1 project director, 2 registered dietitians, CPAs. What does CPA stand for, you guys? It's not what you think it is. It's not certified public accountant. It is.
Oh, man, I don't remember.
It's not what you would
It didn't
think
make
is.
sense. No, it didn't make sense.
Certified
professionals.
Certified something. No, and then a 0.93 support staff and a 1.0 support staff. So that's a total of 4.6.
Competent professional authority.
There you go. Right? You guys would have guessed that.
That is such
Remember that.
a dramatic name.
Dietitians.
Wow.
So moving into 2025, so that's the next slide. We'll keep that 1 FTE project director. We're going to keep our professional time, our competent professional authorities, 0.9 and a 0.87. We're reducing 25% across the board for support staff, realizing some efficiencies through 2024. So we're going to go to a 0.57 support staff. That's the support staff up in Sawyer County. And then our 2 half-time positions are going to be 2.35 that are here in Polk County. So we'll have a 0.7 equivalent in Polk County, total 4.03 FTE staff. And this is all being based on what the state is allocating per participant. So we have per participant numbers up to 500, there's a base. Anything over 500, it's 230, the model is $231 per participant. So along with our budgeting for, right now we're budgeting 1,290 across the consortium. We do believe that with the unwinding for Badger Care and increased marketing efforts, we will be increasing our numbers, and the state will work with us on adjusting our allocations as we increase our workload, so we can staff accordingly. So for the 2024 budget, can you guys see that? It's a little small. Total budget, and what they did was took all of our 4 separate buckets and added them all together for a total budget of about $426,000. We've got some one-time add-on for $50,000 that will be used to buy our Google Voice. In any of the counties that we need equipment, we will be purchasing equipment to get us set up for 2025 for those efficiencies that we would realize. And then for 2025 budget, it goes down because we go from 4 separate buckets into 1. So they're looking at our numbers as 1, and the numbers go down. So what we did, 40% was the fringe. We knocked that down to 30% and lowered our indirect from 8.75 to 5%. Again, realizing efficiencies, the first year is going to be a lot of work on the backside, Kathy's team, making sure that everything's in place. But once we have that in place, we won't need as much admin time. This will all be done through 100% time reports. So we have actual data on what it's costing us. In the MOU, we speak to not going over 10%. 10% is the maximum allowable indirect, and we'll base that based on those time studies that they're completing. So the budget for 2025 is 362,399. Now that's not projecting any increase in participants. So very conservative in our budgeting on that. It's just what the state has projected for us. So next slide, assumptions. Like I've said, we'll have some efficiencies in the administrative, personnel, technology through the first year that will reduce our cost. Increase in caseload through the potentially eligible participant, which will increase our funding. So the state gave us a model on estimated WIC eligibles based on some Badger Care eligible projections. We have a goal to increase participants by 60% across the region. If that is the case and we go from 44% to 60%, it's $27,000 that we will add to that allocation to buy more staff time to administer those services.
Less than your 10%? Is it less than your 10%?
For admin time? Well, our admin is
Less than 10%.
For admin, yeah, we budgeted 8.75 in the first year and then 5% second year going forward. So this could pay for more support staff if they're calling more clients, or dietitian CPA time.
Yeah, we would prefer to put that on the customer side so that we're more dietitian time, more support time rather than our admin time, because once we get our group, it's just a matter of reports and submitting to the state. Okay, so timeline. We're going to committees this month. We were headed up to Burnett this afternoon. That got postponed. Something with their agenda wasn't finalized in time, so they needed to postpone to August 22nd. Sawyer County's is tonight at 6:30, and then Washburn County presents to their HHS next week on the 14th. We've got the MOU is in with Corporation Council, General Government being reviewed. And October is when things really start happening. There's some behind the scenes functionality that the state needs to change with the reporting systems. It's called ROSI to make that one entity rather than 4 separate. So they've got to do their stuff, finalizing our allocations and all of that. And then more work on our local end, meeting up and looking at what those workflows and clinic schedules look like. We do start scheduling January appointments in October, so we need to be ready in October here to have that seamless transition in January of 24. That's what I have.
And are all the other counties handling their own presentations to their individual committees, or do you have to go do all that?
They are, but I've decided to go to those committees to answer questions and support them if need be.
And we already are contracting with Washburn doing theirs.
Oh, okay.
Washburn's WIC director retired last February, so we've been contracting with them to provide WIC. It was a nice way to work out some of the kinks, which they have found some kinks, so it was nice to be able to do that with one company as a pilot.
Any other questions? Yeah, thank you. Wow, that's a lot of work. Way to go, finance people.
Yes, finance people.
CPA.
We will, one thing I didn't mention, the state encourages all of the employees to be employed by the lead county. That is not going to be the case. At this time, I believe that the existing WIC staff will stay in their counties. There's some good longevity with those other staff and we'll ride that out. When the positions do attrition, we would look at then bringing them in-house and having all of the employees through Polk County. It will be funded by the state, so the only thing we would be asking for is additional FTE, possibly when that should happen.
Awesome. Anybody else? Thank you, thank you. Okay, where are we at? Okay, number 17. 16. WCA guidance regarding 2024 budget and shared revenue. Oh yeah, we talked about this last time.
Yes, what I can say, you know, the idea of shared revenue, and John is here, will have many more details, but 566,000 will be coming toward the county. We are reviewing and analyzing and assessing how is the best way to utilize or organize that money. We think now that the restrictions on where those funds go aren't as stiff as we thought. In fact, their early indication is that we can apply it throughout the county. So the question will be, how do we determine how to do that? And that's what we'll be working on over the next month or two as we present our budget.
So that's kind of an answer to my question, which was, can some of the public safety approach to life can include mental health and this department's skill base?
The short answer is probably yes, but
I like his answer better.
that's no guarantee, because we have to assess where that money will be allocated, what types of projects it goes to.
Okay, yeah.
So, and then the question is how to do that appropriately and fairly and where it's most needed.
I can tell you with the shared revenue never would have happened if it wouldn't have been for Wisconsin County Association. They're the ones that big push to get that back in the budget. And came out through some compromises. Like the eligibility and shared revenue, yeah, there's allocation per county is pretty much all set, but how you spend it is gonna be very articulate.
Yeah.
Transportation is the one that wants the big bite out of that.
We just want a little bit.
Yeah,
That's right.
just a little
Did
bit.
anything, it's a.
And everybody wants to buy it with any money that comes up.
Yeah.
So we'll, you know, the good news is that to your question, like I said, the short answer is yes, we'll probably be determining a way to best distribute it to additional funding requests that come in.
Additional funding requests within the county from the different departments?
from the-
Is that what you mean? Okay.
Yeah.
Okay.
And the argument that Wisconsin counties had on that was they wanted the shared revenue to come out of that budget surplus. But
Right.
that did not happen. The shared revenue is coming out of the money, what do you call it? In the
Tax.
sales tax.
Oh, it's sales tax, taxpayers.
sales tax is what built up a big budget
Right.
surplus, and so they did settle that. Shared revenue coming out. sales tax.
Okay, thank you. That's encouraging.
Yeah.
Anything else?
And with that, would the focus be before additional funding requests? Would the goal be to avoid budget cuts first before funding additional funding requests?
Yeah, well, certainly, you know, it will be, you know, it comes into our revenue, I guess is the way I look at it, and will be applied to whatever our needs are within the county.
A lot of questions out there, you know, because it's a first time project.
But we'll get this money every year.
Yeah.
And it will continue. So how,
Should be here
It
to stay.
does.
yeah, so how we decide, you know, it's not a one-time deal, just like we get shared revenue already.
Yeah.
A certain amount, now we're getting 566,000 more.
It's back.
Well, so there are programs that bridge from health and safety to courts to law enforcement. Those are probably the ones that we should hone in on and propose. So, you know,
Law enforcement. and
I want to say like that whole opioid thing, right? But it's forever on my mind.
And with our budget, with all of our budget, we look at all those things. We look at our priorities and look at our.
Right. So whether it's coming out of this committee, I think it may working hand in hand with the sheriff maybe or something. I don't know. I don't know, but I will volunteer to be part of that working. It would be that loud.
We will be
voice, that
presenting
loud.
that, you know, over the next few months as we put together our budget.
Yes.
And what I'm happy about, I think what you guys need to understand about this is initially we were told it had to go to specific areas of the
Yeah.
county.
Yeah.
Now we don't think that's the case. Now we think it
Exactly.
could be out here.
Right.
So it is, consider it revenue into the county and we'll be applying it where it's needed.
Right,
It's
and one
encouraging.
thing about, one thing that, as a taxpayer,
Thanks, Malia.
that I'm more amenable to is when I can see tangibles, right?
Right.
So I know that where they're not just things that I can't see, feel, you know, use my senses to determine what's going on. Like when I go to the farmer's market and I see all the little kids walking around with their vouchers and stuff, that's powerful to me. When I sit down at my annual appointment and my nurse hands me a $10 Dick's coupon to buy vegetables, and that kind of stuff is, to me, is powerful. And I think as a taxpayer, if I see things like that going on, I'm like all for it. If I don't see, if you know what, dude, you know what I'm trying to say?
Mhm.
I'm
Yeah,
having a
you're
hard
making
time.
sense. No, you're
Words are
good.
hard, no copy.
You got it. Tangible.
Tangibles,
Yeah,
yes.
Okay, wonderful. Thanks for that update. That's encouraging news. Okay, now we're 17. Presentation regarding loneliness.
I'm just gonna pass around some packets of handouts here.
I don't know.
There's a full packet.
How many we got here? Two each, three.
That's it this way.
That's all for you there.
So you get all that.
See what we had.
So thank you for the long-awaited opportunity to kind of. Dr. Loggins had brought up back in May at our meeting, I believe it was, the article that was published, actually first part of May, by the Surgeon General about our epidemic of loneliness and isolation. And really wanted to focus on, you know, like the healing effects of having social connectedness. So 2 talking points. what is social connection? What are some current trends that we're seeing? What leads us to be more or less socially connected? How social connection impacts our individual health and well-being. We'll talk a little bit about the 6 pillars to advance social connection, and there's some of those are all handouts that you have, and then some recommendations for stakeholders. So just kind of want to identify definitions of loneliness and isolation. So loneliness can be identified as, being without company or disconnected or cut off from others. Whereas isolation would be being apart from others or being detached from others. Interesting factor is pre-pandemic, 1 in 2 adults reported that they were lonely. So when you think and consider the length of the pandemic and the amount of isolation that we experienced throughout that time frame, can't imagine the increase in that number of individuals. So also something to think about, ponder. In 2017, the American Psychological Association published an article that talked about social connectedness and the mortality impact of that. And they indicated that social disconnectedness has the same mortality impact as smoking 15 cigarettes a day.
My goodness.
So that was 2017, right? 2017. So 15 cigarettes a day, that is the mortality impact that social connectedness can have, or lack thereof. All right, so let's talk a little bit about the 3 components of social connectedness, and that would be, I think, your first handout there. So there's structure, there's function, and then there's quality are the 3 components. So the structure we want to think about as, our coworkers, our friends, our family, our neighbors. The function would be, what is our reliance on those other folks to meet our needs for social connectedness? And then with regard to quality, is it helpful versus unhelpful? Is it a satisfying relationship and connection to this individual, or is it not? Other things to ponder, lots of data in this article. So they talked about how has social connectedness declined. And so some of these factors I'll be giving you were from between 2003 and 2022. So social isolation increased by 24 hours a month. Household family social engagement decreased by 5 hours per month. Companionship decreased by 14 hours per month. Social engagement with friends, decrease of 20 hours per month. And non-household family social engagement was a decrease of 6.5 hours per month. And social engagement with others decreased by 10 hours per month.
Wow.
It's really pretty fascinating. It's a great article. It's really long, but it's a great article. So a little bit of trivia. Dr. Loggis, you can't play along because you know the answers from the presentation to the Rotary group. So do you know what the percent of single person households was in 1960?
Oh, wow.
Yes? 13%. Okay. Now can you guess what it was in 2022?
62.
50.
29%.
You pessimist.
It's kind of dark. So let's talk a little bit about what leads us to be more or less socially connected. So there are factors that shape our social connection. So there's an individual factor. So that's like where we are in our life stage, socioeconomic factors, what is our income levels and those kinds of things. What is our physical health like? Relationships is also a factor, the characteristics, the behaviors of others, household size, our community, what kinds of outdoor spaces do we have? What kind of houses? What do our schools look like? Is there community organizations? Is there public transportation? And then our society. So what kinds of norms and values are there? What kind of public policies are in place that promote? And then what about civic engagement and then historical inequities? So let's look at how social connection influences our health. So you can see social connections and the processes that go in place. So the biology of us, our psychology, our behaviors, and then what are our health outcomes. So when you think about what kind of benefits we might find in advancing social connectedness, you know, we would have potentially happier people who might be more prosperous, maybe contribute more to society. Individuals who, you know, are promoting social cohesion, developing relationships where we live, work, and play, like Polk County. Building resiliency for the future, you know, against other pandemics or other things that could happen, disasters, and then engaging citizens in taking active roles in policymaking and positions in their communities. So the Surgeon General talked about 6 pillars to advance social connection. So we'll cover those here. So what can we do? So pillar 1 is strengthening our social infrastructure in our local communities. Again, so designing public environments to promote social connectedness, you know, public transportation, green spaces, establishing a skill community connectedness program, you know, fostering that community connection, and then investing in local institutions that are going to bring people together. Enacting pro-connection public policies. They talk about the connection in all policies. And connection in all policies is anytime we're developing a policy, taking into consideration, is this policy going to promote social connectedness? Is there potential that it can hinder social connectedness? And then talking through that, making modifications to those policies as we see fit. You know, advancing policies to minimize harm from disconnection, and then also establishing cross-departmental leadership at all levels of the government. We already see some of that as we're looking at policies within our division. You know, how is that going to impact our social connectedness within our own division and our organization? Mobilizing the, there we go, mobilizing the health sector. So training healthcare providers on assessing patients and individuals. So they talk about, you know, social connection is actually a protective factor, right? For our physical well-being as well as our emotional wellness. There are some tools that are being used already in the healthcare sector. A PHQ-9 is a measurement tool that can be used to identify depression scales. There's also, I found a lot of really fun tools that are out there. There's a tool called the Campaign to End Loneliness Measurement Tool. And really what the promotion here is, making sure that we're looking at that whole person when they're coming in for their physical health. What are we measuring? How are we talking with those folks about those? And then looking at that over time, how are those numbers changing? So not just a one and done, but how are they changing over time? And then from the public health perspective, you know, educating about the health benefits of social connectedness. So reforming digital environments, requiring data transparency, really looking at what are the long-term effects that our time spent on our phones has on social connectedness. You know, having some age-related protection for youth. We see how much time our kids spend on their devices and what that social impact is on them. Implementing, you know, safety standards, supporting pro-connection types of technologies, you know, thinking about the impact of marginalization or discrimination on folks using a lot of this digital environment. Abusive messaging, things to think about, Facebook, Twitter, bullying, some of that social negativity that you might see in all of those social media sites. So deepening our knowledge is power. So developing and coordinating national research agenda on these kinds of things. What are these impacts? How do we look at funding and implementing these research studies so that we can put practices in place to help reduce that impact? And then just increasing that public awareness around inclusivity, including academia, not just curriculum in schools, but also in technical colleges, in regular colleges, just to kind of get that information out to people to be aware. The sixth pillar is cultivating a culture of connection. So some of the suggestions they have is, having some values around kindness, respect, commitments to one another, informal practices, looking at workplace values and behavioral expectations as well. And I'm proud to say that Polk County has those all in place. So that's, again, just kind of living through those values and things like that. So the power of one, what can I do? So I think it's important that, we understand the value of social connectedness, that we're nurturing our individual relationships with folks, that we're being present during conversations, not being distracted by this or having a separate conversation, finding opportunities to support and serve our community and the residents of our community. Just engaging with diverse individuals, put yourself out there, give that opportunity to meet people from different walks of life. And then being open with your healthcare provider about what you're experiencing, loneliness. How much are you being socially connected to folks? And then finally, reflecting on the core values of connection. Importance that holds. So these are just some thoughts I wanted to leave you all with. So when you're interacting with other people, keep these questions in mind. How might kindness change the situation? What would it look like to treat others with respect? How can I be of service? And how I can reflect my concern and commitment to others. And just kind of a little promotional word. You can always do something. It's the power of one. We can all make a difference. It just takes one. That was a really brief of this huge article. There's so much more. Dr. Laugus's Rotary Group, I think I spoke for about an hour. So this is really a condensed version.
She did a great presentation to the Rotary Club in St. Croix Falls.
Very fun. They were very patient and very interactive. So it's good.
Wow, thank you.
Yes.
It's a great article.
Good job, Lisa.
I'm interested.
Yeah.
This, what is it, the connections in all policy?
Yeah,
they call it?
yeah.
I'm not sure what to do with that, except for to have that in my radar, or if is there something that struck you about some policies somewhere that we really did a good job on, or just noodle that and, or we missed the boat on that we're.
I hadn't heard about connection in all policy before I read this article. I had been more exposed to health in all policy, right?
Feels a little bit similar.
Right. And so, health in all policy was, anytime, again, we're creating policies around whatever, that we're thinking about how is that impacting our health or the health of others. So similarly, that same connectedness. So when we're looking at, like the green spaces, or, are we going to shut down a park? Any of those kinds of things, to be thinking about how's that going to impact social connection for our community.
Just have a kind of an example with the WIC presentation earlier. As I was listening, it was an excellent presentation regarding all of the resources. We've got the, the farmers market and working with the various grocery stores, et cetera. One thing that was glaringly absent in my assessment was there's a food shelf that is being run. It's a 3-church consortium. It's a wonderful food shelf. It has produce like no other food shelf. There's no financial criteria to go there. And it's not being promoted as available. I mean, it wasn't, and what used to teach us these values, I would say part of our thing is not just psychological, but psychological and spiritual. Churches used to provide that. I mean, they do provide that, but you know, in education, used to be able to say, these are the values, but when kids look at social media now, it's like, we don't see that. We see finger pointing, we see accusing, we see not kindness. And I think the culture is a huge factor here. And we can't be asleep regarding. That's my opinion.
In my mind, and I think I got a pretty broad picture. With the addition of this, that loneliness figure, I think can be pretty deceiving. I mean, these phones, the family connections, especially older people amongst their peers and families and everything, there's opportunity there for communication that never happened before. That loneliness is a factor, but it might not be as bad as what the numbers can say.
But I would say too, that that's really dependent on the individual's desire to do that. I think about my 85-year-old mother. We bought her a tablet. It's like, this is so cool. You can connect with all. She's got, 6 kids and like 15 grandkids and 5 or 6 great grandkids. You can, have video chats with them. And she is so deathly afraid of her tablet. And we tried to do a number of trainings with her. And the other piece is the broadband, right? So they are great, but if you don't have decent Wi-Fi or connection to the internet or service, it's problematic.
I don't know about tablets and Wi-Fi, but my partner was in Golden Age and I spent just about every day there for 6 weeks. And I don't think there was one of them people that didn't have that cell phone.
That's great.
Some of them were hard of hearing and you could hear them say, wah, wah, wah. But they've got connection.
It's definitely a great tool. I think that it just depends on, individuals.
It's been a huge resource.
It can be a blessing and a curse.
Yep, exactly, exactly.
Yeah, my neighbors hosted a kickball party on Saturday and it was like watching kids and adults play together. I was realizing how little I see that happen. I see it at Festival Theater also. That intergenerational connection is another place where those values are taught or those relationships are built. And I was feeling so fortunate to be a part of a neighborhood where like the grownups, and the first thing it did is it put the kids in charge, the 2 girls in charge of the teams. I was like, these are my people. They're so smart. And everybody was just like playing their guts out. And then we had hot dogs and chatted. So I think that intergenerational piece is also a part of this that's gotten broken because we're just all segmented into our little ghettos.
You got a great point there because families with, I think every kid that they're involved in some kind of a little league or so, you never used to see that. And that's bringing people and communications and everything together. All these things maybe might slow down our population. But there's definitely other communications there that are fantastic and are happening.
I think it's just a topic that we probably don't think about often enough.
Yep.
And so it was pretty eye-opening. Thank you very much so much.
Okay, update on the command center.
Ooh.
Is that Vince? Tanya?
I can tell you before I left on vacation, Don was still getting a full overview of the donated vehicle. And then from there, we will look at the 2 vehicles to say, which one meets their needs the best. And we'll be working not only with law enforcement, but with Community Services Division in particular to say, how might utilize this? Do we need to do any design features to whichever one it is? I think it's safe to say we will not keep 2.
We don't need
So, but I think it's certainly something that I think will be used throughout the county.
Yeah, good. I think we should sell one as fast as or sell the old one as fast.
I believe they're working on the new one. They're doing some updating on that one now. And I'll tell you one thing that I told the sheriff's department, if we have our old command center for sale, which we thought, with less than man for the equalization of its needs, that we put that up for sale in Wisconsin auction. And these smaller counties, are you gonna have one for sale? You know, we're gonna get a lot more for our used vehicle than what we thought.
Okay,
Yeah, that's
good.
good. Sell it.
It's amazing.
All right, thanks, Vince. Okay, number 19, discussion possible action on resolution 35.
Yes, in your packet, and I don't have a presentation for this, but I wanted you to see what has been put together. And this is the result of our resolution last month, which asked the staff to put together some parameters. The original discussion was, a $200,000 pool of money. And in fact, if you look at it under the resolve portion 1 through 6, to provide zero interest loans to local municipalities, including the St. Croix tribe in Polk County. We will offer zero interest loans for $10,000 per housing unit with a maximum of $70,000 per municipality. These loans must be repaid by the municipality upon the sale of the property financed by the loan. Maximum loan term for repayment shall be 10 years from the date of the loan. All of these housing projects must adhere to minimum housing standards. The intent is to increase the property tax base with the municipality. And they may include multifamily, senior housing, workforce housing, low-income housing, or other housing developments in the public interest. And the idea is that later this year, we will begin taking applications. We will have a method for analyzing and reviewing those and awarding them beginning in the year 2024. Once it's been approved in the budget, the $200,000. So I kind of give you these bullet points now for you to look at those and to ask questions if you have recommendations or changes. And then it will be on the board agenda this coming month. We'll be presenting it also to general government, who will be making their recommendations on. Yeah.
A couple different things. One, how feasible is it? So let's say Milltown took out a $70,000 loan, use that to help, to bring a developer in, and then upon the, sale or whatever of that property, is it in the realm of possibility that the increased tax base then covers that payment back to the county? Like, have we done any of that kind of?
Well, part of it may be too, when that unit or that, so say that housing development or house unit sells, the developer will pay back the municipality. And then the municipality could pay back the county.
Yep.
So that
And then the other is, this was a direct question from somebody, so this isn't from me. Somebody had brought up the possibility of then the increase is, so say it increases the tax base, would we ever consider offsetting what gets paid back to the county?
Oh, so if it's something that's going to increase the tax base so much that the county would say, we're gonna get more than our $10,000 back in that.
Right.
That's not the intent of this, but that would probably be something outside of this resolution, but one that the board could consider. If
On a case by case basis.
Yeah, I mean, if Amazon says, hey, we want to put a distribution center in your county, you might work a deal, or maybe not. It's not a good example.
I don't even know what the level of property taxes is
Yeah.
for, say, a 20 unit, say an apartment building goes up somewhere. I don't know what
Right.
the level of property taxes is for
Right.
that.
Yeah, keep in mind, this is a small item, all right? We know how important housing is. We know how expensive it is and how it's going up. This is a way to get the county's foot in the door to say, we want to help, we're supportive. It would tell that developer they want us here. It will give that local municipality maybe that spark to say, let's get involved in this. We have to take a proactive step. Many times local communities are waiting for a developer to come to them. This might be a way to initiate with them. Hey, if you have some land or if you have an idea or a place or a need, reach out to a developer. Those developers who come in and talk to you all the time about different things at your planning commission or board meeting, let them know about this. What I hope is that there are developers out there who are always looking for something to develop. This might be that next straw on the camel's back that says, okay, I'm gonna go for it.
And then, sorry, just one last thing.
Okay.
I want everybody to tell me I'm silly on this. It's bugged me the entire time that there's the possibility, if all of it gets used in a short amount of time, that we've got 2 fully funded loan requests and 1 partial. Would it be a pain to make it $210,000 total? So there could
Same exact thought.
Yeah, you're doing the math
Said
on
that we
that.
could
Yeah.
do
This isn't
the
the
art.
funding resolution. This is just the program development with an initial thought on the cost. So this particular resolution doesn't actually change the budget.
Right, I mean, it's outlined in the,
Right.
in the resolution here, though.
Right, so when you guys address the budget in November and you fund this program, because we know the program will be up and running, we can take those applications, this fall, but the funding would hit in January. And so you can address the funding amount then in November. But this was just I don't want to use the word placeholder number, but this is kind of but yeah, math wise, 21 makes sense because 7.
We still have unused ARPA funds too.
ARPA no longer exists.
But it does.
It does, yeah.
The
No.
problem is that's, we were talking earlier about shared revenue. Well, that's something that's revenue that's coming to us every year. ARPA was, my interpretation was this bag of money where we all started reaching in and saying, let's spend it on something. We're done with that. That's now in the general revenue and
So we've
do you have
reached
a-
the point though where we said it should never just go into the general
That's
fund
right.
and be considered a Band-Aid for budgetary purposes.
For
So we
discretionary
finally reached
spending.
the point where we said ARPA is gone and now it's just general fund money.
Back to normal.
That was,
told you
that
that
was
was
the thing where a year or more ago, we were told, do not let that happen. And now we've gotten to the point where it's
Not tangible.
It happened last year a little bit over a year ago, when Chad Roberts was still here and the calculation came down from the feds. And we were able to offset based upon the feds formula. So it wasn't any,
That was the first,
very transparent.
that was the first trunk. The second trunk, we were having
Both
that
chunks, both
trunks.
chunks. This happened with both chunks. It was very transparent, very open.
But we had that whole conversation around like what projects we should do. There was a whole list. We went through all kinds and then that sort of died on the vine and then it went now to the general fund.
Remember,
We never decided to.
Don wants to comment.
So if I could, we will be working with our auditors to determine what the new not committed spendable is from the general fund. So each year they tell us what the general fund change was from year to year. By policy, right now, 50% of that is presumably spendable. We'll take the number that's left over from previous year and add that new spendable, assuming that we came out with surplus, and let the board know what the spendable balance is. So we will be doing that very shortly.
So is it no longer the case that, because it was not too long ago that we were told that we had somewhere, 2.74 million or something like that in quote unquote ARPA funds, that we needed to figure out what we were going to spend that on by the end of 24, and then those needed to be actually put into action by like 26 or something like that. Is that no longer the case?
So what Malia described is accurate. We follow the rules set out by the federal government. And those funds are no longer in ARPA, they're in the general fund. So we have filed all the paperwork on that as of March of this year. There is no ARPA fund anymore. I should put a little asterisk next to that because we still have with our investment advisors a fund called the ARPA fund, and we are changing that to remove any kind of optics issues. All of the balance from ARPA is in the general fund now, officially with the federal government. And soon, just due to naming changes with our investment advisor, that will happen as well. And we will provide the board of this committee with an update on what spendable portion of the general fund is available.
So we didn't lose any of our allocation, did we?
No, absolutely not. And I do have in my grubby little hands the audit report. And as you might have noticed, I was reading it today because it just arrived. We'll be consulting with Jonathan and our advisors at CLA to tell us exactly how much money spendable we have for the board to consider.
So just say, for the sake of conversation, there was still 2.75 million in what used to be ARPA funds that is now in the general fund.
Sure.
Will be updated on what is quote unquote spendable. It's just a different designation now.
Right. And you know, I think back to last year at budget time, for all of the additional funding items that got put into, you know, we came in with a balanced budget and then we voted and voted and voted, and we kept spending more and more and more. That comes out of our general fund where our ARPA funds are. Things like the roof on the Justice Center. The additional money we're gonna be spending on the recycling center.
Right.
The additional money we're probably gonna be spending on the dam. All those things,
I thought the dam was fully funded through.
2 million came from the state, right? So no, it's not totally funded.
There's been increases in the costs.
Big increase.
Big.
What happens if you have $500,000 request for this money, you know, we only have 200,000.
Then the board would decide if, oh, you mean like one person? Well, that,
No, I mean aggregate,
if we had others
all the
come in,
communities in the county.
this sets up the program, and I would say it's a board decision. I mean, we can always amend our budget with the advice of staff to say, do we have that money to spend? And is that a wise thing for the county to do? So that's really kind of a board decision.
If we end up with that, I'll be super happy.
Just one more point on the housing fund, if I could. So this will be, as we lend the money out, whatever the denomination is, it will become a receivable for the county. So it won't actually change our balance sheet. It'll just be a recategorization. So what we will do is if the number is 200,000 or 210,000, we will make sure that we don't spend that twice. So it will be essentially encumbered for future use. Gets paid back, it'll be available again.
It's a loan.
And we don't anticipate everybody jumping in right away. It'll
Okay,
take
Oh, yeah,
time.
they will.
Denise.
Right. So I'm from Minnesota. No, not really. Here's a scenario for you. I'm from Minnesota and I want a summer vacation home, and I find out about this and I come in here and I build $1 million house. And no, nothing with the tax base. I'm not even worried about that at this point. I would like to propose a change to this. And I don't know where you're gonna find it, but on line number 3, where it says a critical need for housing, I would like you to insert affordable housing.
You'll have to do that at the county board level
Oh,
to
seriously?
recommend an amendment, because this committee can amend. This is going to 2 different committees in the county board. You could have a motion to push this through to the county board recommending an amendment in that motion, but you can't amend it here.
Okay, well, I would like to recommend that we define what affordable housing is, because there's $200,000 starting off. Do we want a developer to come in and build $1 million houses? Or do we want them to come in and build affordable houses?
So part of the
Like
thing that we
under
need to,
250? I don't even know what that number is.
I think if you read the maybe toward the end, it talks about the rubric
Couple times.
where we would look at applications, and I think it also
Yes.
says
The decision
Uh,
rubric.
it will be eligible. Yeah, we'll be deciding it based on the need. Now, the need may be something that the local community decide. Do we need something for homeless? Do we need something low income or workforce housing? We don't want, this isn't intended to help the person come in and build the $2 million lake home. That's
Then
not.
let's
the
say
intent.
that. I mean,
but
but if you have a rubric, what is that rubric? And shouldn't that be included also?
And the other thing is I think most of the communities, I give them a lot of credit. They're not looking for that. They're looking for, but yes, we will
Yeah, I
have
was just-
something in that rubric.
I'm just thinking about this whole developing your policies, you know,
One important part of
appropriately.
this, one important part of this to remember is that it's up to the municipalities. So it's unlikely, like I understand the concern about it for sure, but it's unlikely that you're gonna go to Balsam Lake or Milltown and they're gonna decide to take out a $70,000 loan to help push forward somebody's lake house.
But it's only 10,000 per unit.
It's 10,000.
Yeah, 10,000 per
unit.
unit. So I mean, there's multiple layers that are built into it that would make this a really inefficient avenue for somebody trying to take advantage of it for that kind of reason.
Right.
Doesn't the word
Well, I hope so,
affordable
but,
speak,
I mean, it
speak
doesn't
for
say.
itself?
What's that, John?
Doesn't the word affordable speak for itself?
Well, and so that's the other thing is it is,
It's not in there.
it's,
Yeah.
I
He's
would,
arguing we should put it in.
personally, I would avoid putting in affordable because then you're starting to then pigeonhole this thing where we've said part of the important part of this is the openness to the municipalities to decide, because I
Let
personally,
them decide.
once you start saying affordable, then you're moving away from market rate. And I personally think there's a comparable need for market rate housing along with affordable housing. And the point of this program, from what I've understood, is that we're supposed to be making it available for whatever kind of housing municipalities deem necessary. So if it's a market rate 4-unit, 2 duplexes, I think that is just as needed,
Oh, yeah.
but differently impactful from
That is the need.
affordable housing and things like that.
Somebody could live there that wants a job here or something.
Right.
Or they can rent it for $2,000 a month. See what I'm trying to say? I'm all about the affordable thing.
Well, then
I
we-
don't, and then the
But
municipal.
if we designate that it's for affordable housing only, then all of a sudden we're hamstringing every other possibility. And the point of this was for the municipalities to choose what they were.
We're trying to empower the municipalities, is your point. Is that what you're saying?
Yep.
And they have a long list. They have senior, workforce, affordable, there's a whole list.
Because St. Croix is gonna be different from Balsam Lake, is gonna be different from.
Anything else?
Yeah, that helps.
So do we need a?
Linda?
I would say, bring those comments or thoughts to the board meeting and we'll decide and.
Any of
And
those
again-
items, the 210, the affordable can be presented as an amendment.
Not
So-
for us.
But for this today, do we need a motion like for support or?
No, this is just an update, right?
Right, because it's going to 2 committees, so you wouldn't want it to pass both
Right.
committees, because then you probably already have a quorum of the county board. So I would just say, move it along to the county board, and you can
Yeah.
do that by consensus. I don't necessarily think vote unless you want to.
So all in favor of moving this onto the county board?
I-
Same sign? Okay, thank you. Okay. Communicable disease report.
So Helen had to go to another meeting, so she gave me her data. So for July of 22, for chlamydia, there were 6 cases compared to July of 2023, 10. COVID in July of 2022 was 558. July of this year, 16. Lymes in 22, 10, this last month, 29, so an uptick in Lymes. And then she wanted me to make note of July of this year, we had 9 E. coli results, which she wanted to make note of. So that's her report.
You know if those are from swimming or from drinking water?
Ingested
Or beef.
I couldn't tell you.
Remember that raw beef?
Steak tartare?
Steak tartare?
What was your COVID result?
16.
16 in July.
reportable. Yes, I know.
Right, yeah.
I know there's more.
Oh, yeah.
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 I know 16 myself.
And the, the issue currently is that, uptick in a new strain called E.5 that's going around the country. So there's less of the XBB 1.6 and 1.9, but so E5 is now will be the new dominant strain.
Thanks for sharing that, Doc. I
Yes.
appreciate that.
We're gonna go pass that information.
And I know we had a family gathering. The reason I didn't come last month's meeting was because the day before before this meeting, I found out that there were 3 people that were our family gathering the weekend before one came down in Arkansas, one came down in Alabama, and our weekend.
Spread it around.
Spread it around.
And it was none of us were sick. I mean, we tested ourselves and so we tested ourselves twice. It's
You're healthy.
still negative. It's,
Okay, anything else on that?
there's more.
Thank you for being the deliverer of bad news.
Oh, we did.
Okay, legislative report. Do you have anything, John?
I think I covered
Covered it?
most everything except
We were.
on the 5 different
Start thinking.
committees that I went to, 2 of them, and 3 of them in Wisconsin Rapids, 2 of them in Wisconsin Dells. We had, I presented 5 resolutions from Polk County, and one of them was from our group here on housing. And all of them I did get passed, and I believe it was our committee here that sent to our board of directors for what they called, they wanted to review some wording in it, but it did pass unanimous. This isn't under legislative report, but I wanted to ask a question under communicable disease.
Okay.
And I think it'd be legally Polk County under some help. I was at Golden Mage just about every day, and apparently Polk County, or I don't know if it comes strictly from Golden Age, is they're trying to get 15 people in the nursing field from the Philippines. Golden Age is operating at just about half of what it used to be because of the staff reduction. Do you have any comment? Have they talked to you about this, or what is?
Well, that Dana, I believe Dana presented on that
She-
last
she-
month.
she did.
correct?
She did.
Yeah.
So they're working with a
Couple times.
recruiter,
Yep, yep.
and they're trying to find housing, secure some housing or temporary housing if they've got some workers who are ready to come over from the Philippines. So that is in the works, and I know Dana is on top of that.
I just heard all the comments down there at Golden Age. So would that be all help at Golden Age, or would some of it be to Polk County?
I believe it would be Golden Age.
Oh,
Golden
okay.
Age.
I didn't get an answer from that down there, so I appreciate that.
I
Yep.
think Dana said that possibly some people could sleep in there or live in
Yes.
some of the empty rooms
They have
They're-
temporary.
Half of the
setup.
beds
For
are
a
empty.
while.
for a while.
little while.
Right.
They have temporary.
Can I
setup.
piggyback off of that? I didn't know where to say what I was gonna say, but, and I know we're going long, I'm sorry.
No, it's okay.
But I was gonna do it for subject matters for next meeting, but since we just talked about Dana's presentation that I missed last time because I was out of town, I'm super happy that she's given that update and that they've got solutions for that. And I know I'm not trying to make this personal because I know when you have personal anecdotes, like emotions can play into it and stuff like that. But just to share, and I have to say this very plainly just because this is our experience, but my grandpa passed last weekend and he was at Eagle Ridge Memory Care Center in Osceola. And I was already a supporter of any effort to help our staffing issues in these elder care facilities and things like that. And after seeing him in his last day at the place that he was at, I would bump that up to intensely passionate now. To be very plain, he suffered in his last day because of staffing issues that he should not have had. I don't blame the individuals because they're in a position that they shouldn't be in, because the facilities are in the position that they're in. There wasn't adequate enough care, like the people who were there were not able to process and do the things that they were supposed to. There was missed medications, there was miscommunications between hospice. And as a result, he was not comfortable in his last hours. And he had what I would look at as a bad exit from the world. And it was really too bad because I've seen the opposite side of that where adequate care is provided and people are comfortable. And like I said, I don't want to make this sound, we had come to grips with the fact that grandpa was going. We knew that there was no, we understand there's no life-saving measures to be taken, but because of these staffing issues, we saw very plainly that he, I don't mean to keep saying this, but suffered in his last hours because, like I said, it was just a complete drop of the ball. Medications were not at the facility that were supposed to be. Medications were not passed that were supposed to be. And it just was a awful thing to see. And if that was me, I would not only be terrified of being in that position, but I would be making sure that I'm not in that position. I'd be going somewhere else, making sure that I'm going to be in a place where I know that these issues aren't happening. So I know you can't just snap your finger and solve problems, but holy cow, if we could do anything to avoid things like that, that would be good.
Well, and I think that's what Dana's talking about is figuring out how to
And
deal with it.
I could just add to that, this partner of mine, she was at Regions for 6 weeks, Regions and Golden Age, the care of them. None of them are working there for the wages, but she could only be at Regions for 6 weeks and she was transferred. They found a place in Minneapolis. She was there 5 days. I know this is a little bit off. 2 of the 5 days that she fell out of bed, I got a call from North Memorial. Not a word from that facility. I'm sure you came and you were numbered. You rotated in and out.
Yeah, it's a crisis.
It's that desperate all over.
Yep.
So reaching out to Philippines and foreign, in just about every walk of life, you see our foreign people coming in and helping us.
Yeah, they're helping us. Yeah.
Because they don't have the life there that we got to offer. Sorry
Well, Dana
about
can
that.
keep us abreast on this issue at GAM, that we're bringing in more staffing.
And I know the place that I'm talking about is, private, but it's still.
It's hard.
Thanks for sharing.
Oh, yeah, I'm sorry. That
I gotta
sounds
go to
horrible.
another meeting.
Okay.
Are we done?
We're
with-
done. So, okay. Subject matters for next meeting, which is September 12th. Anybody have anything besides our regular work plan items?
Amy, one announcement too.
Yeah.
Annual Polk County Kinship Picnic is tonight out on Half Moon. Our fishing outing with their staff and their mentors. We start at 5, food starts at about 7. So if you want a free brat or hot dog or anything, go with it, come on out.
Did you say that again? What is the
Polk
saying?
County Kinship.
Luau. And it's at.
No, it's not the luau. This is another, this was something that our
Where's it at Half Moon?
it's at Half Moon.
Is it at the pavilion?
Yes, it's at the pavilion. Yeah, this is something that our friendly bass fishermen in the county have done over the years. And it's come down to 2 of us that now organize it and do it and pay for it. So
You live on Half Moon.
we're all
I
good.
do, yeah.
What starts on?
Take a walk over there.
Our fishing outing will be taking about 30 to 40 kids out fishing between 5 and 7. And then we've got brats and hot dogs that that will already be made. And then we've got everything to go with it.
And that's the kinship where like you're an adult mentor for a child.
Yes, yes.
That's excellent.
And last Tuesday was the sheriff's night out.
National Night Out.
Last Tuesday was it?
Yeah, yeah, that was a night out, yeah.
And it was, I was there, it was raining, but boy, the sheriff's department, the way all those people reached out for the kids and
Yep.
nice in our county, we give those people a big thanks. I move to adjourn.
We're not, wait,
We're not.
you can leave if you need to run to your meeting.
Yeah.
Thank you.
Thanks, Doc.
Rita,
Oh, I'm sorry, I was just waiting.
you're waving. Okay,
Will we be ready for 24 budget in September? It's on the work plan.
We will have an additional view on the 24 budget.
it's the 23.
It says 23, but it's really 24.
Oh, good, that needs to be corrected.
Yep.
Okay, do we need to have Andy come again? Because we have it on for September and he covered in August. I
It's
think-
mid-year report. So what are you guys looking for in your reports from GAM, child support and VS?
Well, the GAM piece, I think it sounds like we should have an update on staffing.
Staffing, financials,
Yeah.
financials.
And bed, I mean, if the beds are the same numbers, but I don't know, VSO, you might have an opinion on
got-
where you want. Do we need another update in
update on
in
that.
September?
I don't think.
I don't think we
I don't
need,
think so.
I don't think we need to bug them.
When he's ready for his budget or whatever. Minimal.
So no GAM, child support, VSO, mid-year reports.
I think
Yes,
we should have
GAM.
GAM. GAM, yeah, yes, no. VSO.
Yeah.
VSO, no.
Yeah.
And child support, yes. Those are the
No, those are
departments
the-
that report to this committee, but
Yeah.
not to me.
Okay, yeah,
So
yes,
they're
yeah, okay.
It's like just had that.
Okay.
We still have.
VSO, the VSO, yeah, and then. the child. Excellent.
Excuse me.
So the question is, what would you like in those mid-year reports? What do you want them to report on? We'll make sure they have information for you.
Gonna be missed.
Do you want to know how
Mid-year
busy it is? Do you want to
reports.
know what the
Yeah.
financials are? Do you want to know
Staffing
bed
issues.
capacity, staffing?
Issues, staffing.
You tell me. I'm just throwing out ideas.
Oh, yeah, because we need ideas. We're all like,
Legislation.
Chair Middleton,
yes,
we have the GAM audit.
If you did, I'd be disappointed.
okay, good, okay. Okay, so GAM audit. Staffing, GAM staff.
Staffing and.
And then anything on child support?
And that's.
But this was really good. I
Yeah,
mean, it's what-
I didn't hear it. so.
She had some good
oh,
numbers.
you were here, okay.
I think that was about that. It was child support month though, and they were.
I know,
Yeah,
we
I
should
think
have a
we
mid,
should.
okay,
And
Numbers,
basically,
numbers.
we're the best.
She gave.
numbers.
So more numbers on how we're the best.
That's right.
Okay, numbers on how we're the best. And
For Polk County specific, I think those were a lot of.
Yeah.
you want us to know.
It shouldn't be hard.
Yeah, okay, we're not being very helpful, but you get kind of the point.
As long as you guys have.
I know.
So are we saying though, because it's a mid-year and different than our other presentations, that we should have Andy back? I don't,
I guess we should discuss what exactly that mid-year report needs to look like. Is
Yeah.
it mid-year?
or if he feels like he wants to come back, he's of course invited, but I just
The
felt like he was
goals,
just
yeah, You
here.
know, what are the,
So
Would he need to come back anyway to give his report on the 24 budget? Be there for,
what we have is we'll have the financials through June 30th. So that would be the mid-year. And they lag 3 months, and we could roll that in for any department that you'd like to hear about.
so that's,
I think this is definitely a discussion that you guys should have when you develop the work plan for next year, because we do have a lot of updates from these 3 different ones, when it's the end of like the previous years, when it's the mid-year, what you want to see
Yeah,
in each one of
Then
those.
we should
There
see,
is the development for the work plan in December. Obviously, we can look at that in an earlier time, but it is something that start thinking about those things. So when we do the work plan for next year, we know exactly what we want. So there isn't this question for which one's presenting when
But what are
and
you,
why.
when you're getting these mid-year reports from them, are you saying you're getting, you
I
know?
don't get any reports, but we put things on the agenda based on what's on the work plan, so
Mhm.
we can't,
No,
us and
yeah,
or Tanya can't reach out unless we know exactly what you want
right.
on there. So definitely things to think about and consider for the work plan for next year on narrowing these down and exactly what you want presented for each of these categories at each update.
Yeah. So for our next meeting, we're gonna have GAM. I don't think we need Andy, but maybe we do. If he's got mid-year numbers, is he calculating something or is this something that he's gonna have to create just for us?
We run those for every department and division.
Financials,
Yeah,
not,
yeah.
Just the
do you want to
financials.
know how many people he served, how many, that report that he does?
I don't think you'll need Andy.
Okay.
I don't think there would,
I don't think so.
I think let him do his work.
I agree.
Nothing new and
He's busy, we know that.
But GAM and child support, if we can have some numbers from them, that would be helpful. And then the staffing for GAM is obviously a point of conversation. Okay. Thank you. Okay, I'll take a motion to adjourn.
Motion to adjourn.
Second.
Second.
Thank you.
Lunch.
everybody else.
Yeah. Tonight.
Anyone?
I was like,